Hey guys, Dr. K, a little cloudy, feels pretty warm today. Actually, before it starts pouring, we're going to take the M2CS for a little spin, maybe do a little cars and coaching, talk a little bit about Burnout. Love the plates on this car. ER Doctor. Let's start this baby up.
Absolutely filthy because of the weather, of course, but it's a little bit warmer like my dad was saying. But I love these bronze wheels on the M2CS. Has a steel brake, so not the coveted carbon ceramics that everybody talks about, but this beautiful carbon fiber all throughout. I love this car so much. It's like a GT4. My friend and I were talking about this today. It's like a GT4, not the same as a GT4. I think the GT4 is a better overall car, but this just looks so sick. Bronze on black, I don't think you can get a better combo. Of course, in the gloomy weather, it might be a little hard to tell, but that carbon fiber roof is so sick. Again, looking really gloomy out, but we're gonna go for a little ride. I'm gonna hop in here now. Love the CS in the dash, so cool.
It's nice how they stitched it in. Just saying, we were talking about it, you were showing me a couple of videos. What I'm noticing is that a lot of the residents, as well as the attendings, are starting to walk away from medicine. Now, it's one thing to walk away when you've already had the career for a few years, 20, 30 years. Okay, maybe you want to walk away, that's fine. But there's people that are out for 1, 2 years, or they're in the middle of their residency and they're calling it a day, which is really heartbreaking, because if you think about it, when you're in your second year residency, you went to 4 years of college, 4 years of medical school, and now 2 years of residency, and you're walking away, whether you have loans or not. That amount of time that you invested is huge. And there was a reason why you wanted to do it. So there's something that must be broken with the system that's forcing everybody to say, hey, the hell with this, and I'm getting out. And I think part of it, and we talk about this a lot when we talk about burnout, is lack of autonomy. What's autonomy? It's your ability to do what you want to do with your team without somebody micromanaging you. So when I first came out in '87, not a lot of docs were owned by organizations. Now, if I'm not mistaken, 73% of all physicians are employees of large health systems or of corporations, and they lose their autonomy. When I was started out in medicine, we were very entrepreneurial. We started our own ER group, me and 3 other guys. We hired a bunch of physicians. All the docs that were on staff were their own docs, meaning they weren't owned by the hospital. It's not that the hospital is a big bad wolf. That's not what I'm saying. But what happens is you get this paradigm shift from being autonomous and doing things by yourself to now being told what to do, when to come in to work, how many patients to see, etc. And I think that lack of autonomy is causing them to actually leave. EC and Ryan, 2 psychologists from Minnesota, they talked about the self-determination theory, and you have to have the self-determination theory in order to be psychologically normal, if you will, and have the ability to grow. And the 3 things that they talk about is that you have to have autonomy, you have to have relatedness or belonging, and you have to have competence in what you do. And I think what's happened because of the paradigm shift as to how medicine is actually working now is that autonomy is gone. And if people don't understand autonomy, I may not be 100% right on this. I'm not a psychiatrist, I'm an ER doc and an old administrator, but autonomy is your terrible twos. Think about it, when you have a 2-year-old at home and they start yelling, no, I want to do it myself, that's autonomy. Look how aggravated they get. So a lot of the people that are older are screaming like the 2-year-olds inside to say, no, I want to do it myself. And the current system doesn't allow for it. And I think some people are actually stuck because of the financial or monetary pieces. They spend so much money going to school that they can't walk away and they're miserable. So I think it's important to change your mind shift a little bit, or your mindset rather, and look at things from a different perspective. Physicians are needed, let's face it. We do a lot of things. We help people, we alleviate suffering, right? That's extremely important. So how do we bring back that quote-unquote purpose or joy of medicine to stop all these young guys from leaving? Because they're bright guys and we need them in order to stay healthy. As I actually reflect, I think part of why I left 2 years ago was because of burnout myself. And I don't want to make it sound like I'm complaining about the big organizations, because the bigger an organization gets, the more structure it has to have, and the more the autonomy is really lost. So it's very hard to be able to just let people do whatever they want without having a standardization across the system. But when you're autonomous and you're able to do things for yourself, it gives you a lot of pleasure. When you look at it, that's that intrinsic motivation. Putting your fingerprints on things and saying, hey man, I created this. But if all you do is just follow directions, that causes you to have no autonomy and causes you to burn out. And as I reflect, I think a lot of that burnout that I had came from that same reason, a lack of autonomy. Now, as I do stuff for myself in the coaching business, and I have my own autonomy, it's a lot different. And I think that's extremely important. And it doesn't have to be the healthcare industry. There's lack of autonomy in all kinds of industries, right? So you could be a lawyer and be working for a large firm and they tell you what to do. That's lack of autonomy. Or you could work in industry and corporate in the C-suite, and you could end up having lack of autonomy. So it's really important to let people do what they want to do within the guise of performing towards the mission and vision of the organization. But take a look and think, hey, am I losing my autonomy, and how can I get that back? I think that'll help you out significantly. And for those of you in the medical field, let me know. Shoot me a DM. Why do you think everybody's leaving? For those of you docs that are in training or students, let me know what's causing you to get that feeling of being burnt out to the extent where you sacrifice what I imagine most of you dreamt about doing for the rest of your life, and all of a sudden say, hey, listen, I can't do this anymore.